Next, a special time for the Minnesota Department of Health press conference on the latest on COVID-19. That will delay the start of Science Friday somewhat. And we also heard a remembrance of our public radio colleague Neil Conan this past hour. The former Talk of the Nation host died this week at the age of 71. You can hear that program in its entirety at its usual time, fresh air at 8 o'clock this evening. So, coming up next, a bit of a switcheroo with the delay of the start of Science Friday. Hopefully we'll get some of Ira Flato on as we conclude the briefing here in the next hour. In the meantime, it's looking nice this afternoon, 77 and sunny in the Twin Cities at 1 o'clock.
Programming is supported by the Medtronic Foundation, coming together with Medtronic employees through advocacy and volunteerism to support underserved communities, locally and around the world. Learn more at medtronicfoundation.org.
Good afternoon. I'm Stephen John. It is 1 o'clock. The Minnesota Department of Health is about to brief reporters on the latest information regarding COVID-19, and we will listen in, as we have been doing since these conference calls first started with the arrival of the pandemic back in March of 2020. With time remaining in the hour, we'll rejoin our regular program, Science Friday. Health Commissioner Jan Malcolm and State Infectious Disease Director Chris Erzman typically have been conducting these occasional briefings at 2 o'clock, but apparently moved the starting time up today to avoid conflicting with a separate media appearance Governor Walz is holding later this afternoon to promote the vaccination effort in Minnesota. Elsewhere this hour, the University of Minnesota's Board of Regents is meeting and will discuss a new policy that would require students and employees to be fully inoculated against COVID-19 once the vaccines get final federal approval. With the board's confirmation, the policy will require those on campus to show proof of vaccination. You may recall that the Food and Drug Administration has only granted emergency use approval of the Pfizer, Moderna, and Johnson & Johnson vaccines. The university's policy would not become effective until the FDA fully authorizes the vaccines.
Good afternoon, everyone.
Jan Malcolm has begun. Let's listen in here on NPR News.
And we thought it would be a good opportunity to update Minnesotans on what we know. Today, Minnesota is reporting 1,336 new cases and 6 more deaths. That brings us to a cumulative total of just under 625,000 cases, nearing that number, and 7,729 deaths. I'll just note that that's in the context of global and national numbers here that are really striking. We're now over 205 million cases all around the globe, going up at more than from 600,000 to a million cases in a single day around the world. And now over 4.3 million people have died of COVID-19 around the world, 9,000 just since the prior day's report. And in the United States, we're now over 36.3 million Americans having contracted COVID-19. And unfortunately, as a nation, we're going up by over 100,000 cases a day again, adding a million in a week. And 619,000 plus deaths in the United States. Most recently, 600 in the prior day. I mentioned those numbers just because that's the kind of the amount of transmission that's going on in the country and around the world, and every one of those new cases is a fresh opportunity for the virus to continue to evolve and mutate, and we've seen dramatic evidence of that in the numbers of variants that have developed over the course of the pandemic, and the just extraordinary dominance now of the Delta variant. We'll talk more about that in a minute. It's concerning, back to Minnesota data, concerning to note how quickly we have gone up into higher transmission categories according to the way CDC looks at transmission risk. CDC's county metrics now show that more than half of Minnesota counties are now in the high transmission category. We started at, I think, 8 counties that were in that category. Now we're over half of our counties in high transmission. Almost all of the other Minnesota counties are in substantial transmission, and only 7 counties are in the moderate transmission level, and no counties are below that level. Unfortunately, we're seeing cases in some of our most vulnerable populations also increase. We have seen a pretty marked increase in both staff and resident cases in congregate care facilities over the last week. Up actually, in terms of staff cases, 300% increase in number of cases per week from 4 weeks ago. 98 cases were reported this past week. And resident cases, we saw 59 new cases this past week. And as mentioned, the Delta variant is now so widespread and growing so quickly. It now accounts for more than 95% of the sequenced specimens in Minnesota, which is similar to the U.S. overall figures. Wanted to comment on the FDA announcement last night that they have updated the emergency use authorizations for Pfizer and Moderna vaccines to allow certain people who are immunocompromised to get a 3rd dose of COVID-19 vaccine. This announcement is really a welcome development in helping to protect some of our most vulnerable Minnesotans, because the data have really become much more clear in recent weeks and months that people who have a compromised immune system may not develop a good immune response to the first 2 doses of COVID-19 vaccine, so that a 3rd dose may help improve their protection. And we've heard some heartbreaking stories of people with compromised immune systems who did absolutely everything they could do and still succumbed to COVID-19. Now, this FDA update does not change the recommendations for those who are not immunocompromised, including fully vaccinated people who are otherwise healthy. The federal government and medical researchers continue to evaluate the data on the potential benefits of booster doses in other parts of the population, but those data do not yet indicate a need for additional boosters in the broader population. But again, those data will continue to be gathered and evaluated and may happen in the future. We're reviewing the FDA updated authorization from last night, but very importantly, waiting for additional clinical guidance from the CDC's Advisory Committee on Immunization Practices, ACIP, including specific information on what qualifies as a subset of immunocompromising conditions for which the 3rd dose is now authorized. So the ACIP is meeting this afternoon, and once we get their recommendations, we will pass that clinical guidance along to our vaccine providers in Minnesota, and they can begin administering doses to those patients in their populations with those specific conditions. Anyone who thinks they may fit into this immunocompromised category should wait to seek out a 3rd dose of Pfizer or Moderna from their providers at this time. But Minnesota is prepared to begin offering additional doses to the people who are in the category that ACIP will further specify this afternoon. And there are plenty of vaccine doses already here in the state to vaccinate, give 3rd doses to this eligible population, along with everyone else who is eligible for 1st and 2nd doses. And we're working with our vaccine providers, our clinics, our pharmacies, our local public health agencies, community clinics, and others to ensure that they're able to begin vaccinating immunocompromised persons once we have those ACIP recommendations. The recent increase of COVID-19 cases that we've been watching with concern these last weeks here in Minnesota and the spread of the Delta variant underscores the importance of everyone who's eligible getting vaccinated as soon as they can. The more people who are vaccinated, the more protection we'll have in our communities to help those who are not able to be vaccinated or who have conditions that mean they may not respond as well to the vaccine. These vaccines work. They are extraordinarily effective at preventing especially serious illness, hospitalization, and death, and they will help to protect you, your family, and your community. want to comment specifically about what we're seeing among younger people with COVID cases during this Delta spike. We've heard CDC and others in recent weeks describe the current Delta spike across the country as a pandemic of the unvaccinated. And unfortunately, the category of unvaccinated includes children under the age of 12 who are not yet eligible for the vaccine. And while there was a perception early on that the virus was really of very little concern for children and young adults, we've known all along that there are certainly sad exceptions to that rule, to that case. Recent data on the Delta spike shows young people can indeed contract COVID-19, and it's really important that they take precautions. Some recently published data from the American Academy of Pediatrics quantifies that recent increase in infection among children. The AAP data show that in Minnesota, over 18% of our cumulative cases fall in that pediatric age range of 0 to 19, compared to an overall national percentage of 14.4% of cumulative cases falling in that same age range. Looking back at our own data from MDH, as we've reported before, we continue to see younger age distributions of cases. During the big fall surge in 2020, kids 9 and younger made up roughly 5% of our cases, and older kids aged 10 to 19 made up about 12% of cases. But over the past 2 months, the overall share of cases among kids 9 and younger has almost doubled. Again, this is in the last 2 months window, to almost doubled now to 9.6% of all cases in the last 2 months. The increase over that same time period in older kids is less pronounced, but it's still up slightly to a level of 13%. So up from 12 to 13. Kids under 9 went from 5% of cases up to 9.6%. And of the almost 3,700 cases among children 19 and younger that have been detected in these last 2 months since early June, more than half of those, over 2,000, were detected in the most recent 2 weeks by specimen date. And while it's still very low, the likelihood of child cases being hospitalized is also greater in recent months compared to the fall 2020 peak. Since June 5th, 2.2% of cases among children 19 and younger have been hospitalized, while that hospitalized fraction was less than 1%, 0.7%, in November and December of 2020. And as we've said, we've seen the share of cases being hospitalized increase across all age groups with Delta in recent months, but the largest increase has been in this child group. And like case growth trends, hospitalization numbers have also been increasing. Of the 83 hospitalizations among kids under 19 in the last 2 months, 25 of those hospitalizations were in the last 2 weeks. All of this is just to say again that COVID-19 most certainly is a risk for people of all ages. Severe cases, those leading to hospitalization and death, are still far more likely among older people. That remains true. But no parent wants to have their child suffer needlessly, and so we all need to work together to limit the transmission of this virus as much as we can. That means all of us getting vaccinated when we're eligible, masking in areas and settings where it is recommended, staying home when sick, getting tested, and supporting our schools and local officials when they take preventive actions to protect students and community members. With a virus as contagious as Delta, and as we have said, it is a whole different game, we all need to do our part. And with that, I'd like to turn it over to Chris Erzman.
Thank you, Commissioner. We've been getting a number of questions recently about the state fair and other large gatherings in light of the increase in cases that we're seeing statewide. While we're all excited to return to fairs and festivals and other events this summer, we want to remind people that these large events, even when held outdoors, do present a risk of COVID-19 transmission. With the new and more contagious Delta variant circulating, it's more important than ever for people to take the right precautions to protect themselves, their families, and their community. For some, especially those at higher risk for severe disease from COVID-19, or those that care for or live with someone at higher risk, that may mean deciding to avoid large events right now. For those who do decide to attend, there are things you can do to reduce your risk. The more steps you can take to protect yourself and others, the safer you'll be at the gathering. But we know that there will always be some risk at these events. So we advocate a layered approach. That includes getting vaccinated. First and foremost, it's very important to get vaccinated as soon as possible. This is the single most important thing you can do to protect your family, yourself, and your community from COVID-19. And just to remind you, being fully vaccinated means you have to wait 2 weeks after receiving the Johnson & Johnson single-dose vaccine or 2 weeks after receiving the second dose of the Pfizer or Moderna 2-shot vaccines. Mask up. If you are in an area with substantial or high COVID-19 transmission, MDH and CDC strongly recommend masking up indoors, whether you are vaccinated or not. And if you're not vaccinated, it's also recommended to wear a mask in crowded outdoor settings when you can't keep at least 6 feet away from people. And keep in mind that the commissioner commented on what a large proportion of our state falls into that category of substantial and high COVID transmission. Get tested. If you have any symptoms of COVID-19 or have had close contact with someone who has COVID-19, get tested. To limit the chance of spreading COVID-19 to friends and family, it's also a good idea to get tested 3 to 5 days after a large public event. And certainly stay home if you feel sick. And as we say all the time, wash your hands frequently. We know it's difficult for many to think about foregoing big events when we've had to miss out on them last year. However, we're not out of the woods yet. And if we want to get past this, we all need to do our part to protect ourselves, our families and friends, and our communities from the harm of COVID-19. Now, I do have some good news to share from this week. Thanks to a recent rise in vaccination rates, we were pleased to announce yesterday that Minnesota has surpassed 70% of adults 16 years of age and older with at least one COVID-19 vaccine dose and more than 6 million total doses administered. The number of first doses administered per week is up 129% from a month ago, which is wonderful. The latest vaccination numbers show Minnesotans are answering the call and doing their part to get us to the end of this pandemic. We've said many times that vaccines are our best tool for overcoming COVID-19 and the Delta variant. And so it's very encouraging to see that millions of Minnesotans rolled up their sleeves to protect themselves, their families, and their communities. According to CDC data, Minnesota leads the Midwest in the percentage of the overall population who have completed their vaccination series at 54.4%, and of residents 65 and older with at least one vaccine dose, 93%. It's certainly worth celebrating the milestone, but it's not the finish line. There's a lot more work ahead to make sure Minnesotans are as protected as they can be. We need to make sure every Minnesotan who can get the shot does so. It saves lives and reduces the harms and disruptions of this pandemic for everyone. The Delta variant underscores the importance of getting as many people vaccinated as possible as we approach fall and back to school. And as a positive reminder, Minnesotans who get their first dose of COVID-19 vaccine between now and August 15th can get a $100 Visa gift card. Minnesotans can get their free shot in a number of ways. You can walk in or make an appointment through the Vaccine Connector, and that's vaccineconnector.mn.gov. You can use the state's vaccine locator map to find a vaccine provider near you, and that's mn.gov/COVID-19/vaccine/find vaccine/locations/index.jsp. You can check for vaccine appointments using the vaccine finder on vaccines.gov, and you can certainly contact your primary healthcare provider or a local pharmacy. But please do look into getting vaccinated if you have not done so yet. And with that, I'll turn it back to Mike Schomer.
Thanks, Chris. Operator, we're ready to take questions.
Thank you, presenters. As a reminder, to ask a question, you'll need to press *1 on your telephone. To withdraw a question, press the pound key. Please stand by while we compile the Q&A roster. Your first question is from Bill Werner from Minnesota News Network. Your line is open.
Thank you. Commissioner, I have really two questions. One is first a clarification about what you said about people who believe they're in the immunocompromised category, that they should wait to seek out a third dose from their health care provider. Can you just clarify, should they take the initiative and contact their health care provider or wait to be contacted, or what's the procedure there? And the second question I have is relating to the number of cases in congregate care facilities. And I'm wondering, are we seeing any significant increase in vaccination rates among staff at congregate care facilities? What's the rate among residents, and what kind of rate are we seeing among staff? Has there been any significant increase, and is there anything the state is doing to try to jump that number up? Thank you.
Well, thanks, Bill. First, on the question of immunocompromised individuals, we're just trying to make it clear to folks that we don't yet have the specifics on which conditions are going to be considered appropriate for a third dose until we get that further clinical guidance from the ACIP. So if a person were to call this afternoon, their provider wouldn't be able to answer the question about whether or not they are in that category. I do know that a lot of providers, just as we did for first and second doses, a lot of those providers certainly know who their patients are with these particular conditions, and I know they will be doing some outreach, but certainly people can call their regular source of health care, their doctor, within the next day or so, start doing that if you want to check on your eligibility for that third dose. We'll get a little bit more specific definition later today and certainly share that publicly.
Thank you. I appreciate you clarifying that. Thank you.
And then your second question, Bill, on congregate care settings, I'm going to ask Chris if she has the most current vaccination rate numbers. The short answer is yes, we are seeing some uptick in staff vaccinations in congregate care facilities. Still not as high as we would like it to be, but it has been improving. The incentive programs, certainly we hope are helpful to that population. There are going to be some continuing grants to healthcare providers and community organizations going on later into the fall to allow those organizations to tailor some specific incentive programs. And that would apply to long-term care as well. So we definitely are glad to see, many facilities and organizations with multiple facilities doing things like requiring their staff to be vaccinated or else to be tested very, very frequently. So those kinds of developments, I think, are all moving us in the right direction. But we'd sure like it to go faster, especially given the rises in Delta right now.
Do we have actual numbers available on vaccination rates in congregate care statewide?
Yep. Bill, this is Chris Ayers-Min. I will check to be able to try and get you the most recent. We get those from self-report from facilities. What we had seen before the more recent pushes was that residents, vaccination coverage of residents was in the 88 to 90%, but for staff it was more like 50 to 60% in those settings. And so, as the commissioner said, We've really worked with our partners in long-term care. Some have instituted mandates. We have the incentives, and we're working to do more education. So certainly working to get those numbers up, and I'll see if I can get the most recent numbers. But to be clear, we do surveys of facilities to get those numbers.
Okay, I appreciate that. Perhaps maybe Mike could facilitate that or whatever. I know he has my email, so thank you very much. Both appreciate it.
Your next question is from Jeremy Olson from the Star Tribune. Your line is open.
Hi, you were given a lot of guidance to individuals about how to deal with the Delta variant rising COVID risks, but I'm wondering if you are going to be putting out guidance to organizations, specifically schools, large events like the state fair. I mean, you have the power to give them advice saying, hey, this is what you ought to do to reduce transmission or to even if issue stronger guidance, and I'm wondering if we can expect any of that soon.
Well, Jeremy, as you know, I think we have updated our guidance for K-12 settings and this large gathering guidance, which is certainly intended for individuals, but we've also, whenever asked, give advice to organizers of large events about things they can do to help mitigate the spread. Certainly encouraging, decongestion as much as possible, and recommending that masks be worn by those who are not vaccinated, and even in close crowds for people who are vaccinated. So, just trying to make sure that people understand the continuing value of masking. So we're giving that guidance to organizations as well as individuals. But in terms of, it is in the realm of guidance and strong recommendations. We want people to know that, these recommendations from the CDC are based in, current recent data, and we strongly urge people to follow them.
I had a side question on the breakthrough data, because when you do the math of the number of fully vaccinated people versus the number of known breakthrough infections, is about 0.19% of fully vaccinated people have been identified as breakthrough infections. But those are the people you know about, and presumably there's an unknown quantity of people with breakthrough infections who have mild or asymptomatic cases and aren't getting tested. That's always been an elusive number from the start of the pandemic, but I'm just wondering if you have any sense of whether there's a larger population out there, people who have suffered milder breakthrough infections that we don't know about, and is it more prevalent than perhaps in the prior COVID waves?
Well, Jeremy, it's a great question, and just as you said, we've always said that the cases that are diagnosed through testing, we know are a subset of the true number of cases that are out there, and we think that certainly applies to breakthrough cases as well. And as Chris shared, there continues to be more data literally every day on Delta, but it does appear that there are more breakthrough cases with Delta than with the earlier strains. Chris, I don't know if you'd like to add to that.
Yeah, I'll just comment, Jeremy, that even among the breakthrough cases that we're reporting, we do have a proportion of those that are asymptomatic. So we are identifying asymptomatic breakthrough illness. But we are seeing that with Delta, the proportion of breakthrough cases has increased, and that we're seeing that in Minnesota, and that's true nationally. What's important to keep in mind is that although we are seeing a slightly greater proportion of breakthrough cases, the vaccines are continuing to do their job. We're seeing good protection against severe disease, hospitalization, and death, and that's really the ultimate goal. So I think that it's important for us to note how, for instance, the Delta variant has changed from Alpha, which has changed from the wild type. But I also think it's important for people to recognize that even as we're looking at these nuanced changes, that the vaccines continue to do the job that we need them to do, and that is to prevent severe disease, hospitalization, and death.
Thank you.
Your next question is Catherine Richard from Minnesota Public Radio. Your line is open.
Hi, I just want to quickly clarify something and then get into my question. So you said you're waiting on guidance on who qualifies for this third shot. Just looking at the FDA's website, it does say that solid organ transplant patients are among those, or those who are diagnosed with conditions that are considered to have an equivalent level of immunocompromise. Is it that second group that you're waiting for some clarification on? Or just more broadly, like which transplant patients would be included? I just want to make sure.
I think both, Catherine. Yeah, both questions.
Okay.
If I could add, I mean, based on the ACIP conversation today, that second group of equivalent immunosuppression, it's an extremely complicated and detailed list, and so that's why it's important that we get guidance from CDC on that.
Got it. Okay. So my question has to do with booster shots more generally for people. Anecdotally, I know people have told me, so I know some people who've actually gotten a booster shot, in some cases of a different vaccine because they're concerned about the efficacy of the first one. I mean, what's your advice to people who, aren't immunocompromised, just going out and getting additional shots at this point?
Well, this is Jan, and I'll start, and Chris, you certainly chime in. But the CDC and Dr. Fauci continue to say that is not recommended. Booster doses are not recommended for anyone outside of this current category. They are continuing to look at it, and I think Dr. Fauci has said publicly that it's likely that boosters will be necessary at some point for a broader group of people, but that point is not now. So CDC is actively discouraging vaccine providers from providing third doses to anyone other than this group that's just being added now.
Yep,
and just to follow up on, go ahead.
Oh, I was going to say, I'll just reiterate that. I think, one of the things that's really important is the recommendations that are being made right now are based on strong data. And so, before booster doses for the general public would be recommended, we need to have clear data for those recommendations that would indicate when it's appropriate to get a booster dose and to make sure that they've been fully evaluated. I think, the idea if 2 is good, 3 is better, it is not necessarily true, and we need to make sure that people are getting what's appropriate for them, and until we have data that can help direct that, we aren't in a position to be recommending additional doses for the general public.
So just to follow up on that, I'd be interested in getting your take on this study using Mayo Clinic data that has not been peer-reviewed yet, to be clear, but that suggests that Pfizer's vaccine efficacy is waning against the Delta variant. I mean, how should the general public interpret that information?
Well, I think it's important to just reiterate what Chris said. That study is just come out, as you said, and that Mayo is saying the effectiveness of the vaccines is holding up on the most important measures, which is our severe illness, hospitalization, and death. They are reporting in their data a larger proportion of getting infected, but with mild disease. So that's the kind of data that will continue to be gathered and looked at the national level. But it is definitely not the case that Mayo is saying the vaccines are less effective. It's that narrow first question of less effective at preventing any infection, but not less effective at preventing severe disease.
And if I could add to that, just to make the point that in order for us to get a handle on variants, and Delta is obviously a more significant variant than we saw with Alpha, but in order for us to get a handle on what could come next, we need people to get vaccinated, because really the breakthrough infections that we're seeing are the collateral damage to vaccinated persons from what's happening predominantly in our unvaccinated communities. So I think that while it's important to note how variants change the landscape and how, they are more transmissible and all of these things, I mean, I think the important message is that we need to get a greater proportion of our population vaccinated in order to be in a better place to control and address variants, or we will see more and worse things coming down the road. So I think that's really an important message, is that this breakthrough really ends up being the collateral damage of the transmission that's happening within our unvaccinated population.
Thank you.
Operator, I think we're ready for the next question.
Thank you. Your next question is from Steve Kermowski from Associated Press. Your line is open.
Yeah, hi, thanks. Just wondering, given the surging concern over the Delta variant and the rise in testing that we've been seeing since July, are you guys seeing any significant capacity issues or delays in patients getting results back from our testing centers?
I am not aware of any reporting slowdowns from the labs. At least the laboratory that we use for state sites. Chris, do you have any insight into reporting times from other labs?
No, we have not been made aware of any delays, and although we're seeing the demand for testing increase, it is nowhere near where we were in the winter or the late fall of 2020. So we have not been made aware of any delays.
Your next question is from Jennifer May-Earl from WCCO-TV. Your line is open.
You've answered some of my questions, thank you, already, but I do have a question. I know we don't know exactly who this booster shot impacts yet, but do we have an idea about how many Minnesotans this could impact, even a range?
Now, Chris, I know you've done some modeling of that.
Yep, and just let me just start with one thing. I'm hearing people use the term booster shot, but actually ACIP is being fairly specific and not calling what they're recommending a booster shot, but rather an additional dose after an initial primary vaccine series for individuals for whom their immune response was insufficient. So they are not calling this a booster dose, and I think that may be an important distinction since we want the public to recognize that this is not for everyone. A booster dose is a dose of vaccine that's administered when, a person's had a sufficient immune response initially, but then you've had some waning immunity. So just, you wouldn't know that, but I'm just thinking in general for, as you're describing this, that may be a good way to make it clear for the public. And then in terms of the proportion of the population, some of the estimates that CDC has done have estimated that 2.7% of the population would fall into this more severe immunocompromised category. And in Minnesota, looking at our 18-plus population, we estimated that was about 115,000 people, a bit over that.
Good, thank you. I have another question about the congregate care facilities. Do you have? I know you said you had some data about the vaccination rates of people reported, but do you have any indication of the rates that are going up there now, if those are among unvaccinated staff members or patients, or among vaccinated?
Chris, do you have any data at that level?
Yeah, we are seeing, what we're seeing is we are seeing, disease being brought in generally coming in through unvaccinated staff. We do see, as I said, that collateral damage where we can see vaccinated staff and residents then becoming ill. So we we are starting to see, activity in our long-term care settings. But the good news is that we're not seeing it as many cases or the rapid spread that we saw before we had vaccine coverage.
Okay. And one final question, if you will, on the kids that are staying sick. Any indication of why this is? You're seeing more kids just even in the last 2 weeks as we have previously?
Chris, you want to take that one?
Yep. Sure. I think it's probably, one is we need to continue to learn more about Delta and if there are specific things about it that make it, a greater risk to children. But I also think that as we're seeing, Delta incidence and transmission increase in the population, our 12 and under population and even some of our adolescents, it's a large group of susceptible individuals. And so that is going to put them at risk as well, just on the sheer increase in transmission, aside from unique characteristics of the variant.
Okay. Thank you very much.
Your next question is from Quinn Gorham from KBJR 6 TBS 3. Your line is open.
Hi there. I just wanted to ask, with the rising cases that we're seeing, particularly from the Delta variant, is there a possibility we may soon be seeing more shutdowns of businesses and places with high indoor capacities, like bars and that sort of thing?
This is Jan. Just a reminder that the situation is pretty different now. We are not anymore operating under a peacetime emergency, so the state does not have that ability to make those restrictions at this point in time. Those are decisions, though, that private businesses certainly can make, as well as local jurisdictions, local units of government. So we may see more action locally as transmission rates are increasing in specific areas, and we think it's highly appropriate that businesses and local units of government have that ability to make those decisions. So Minnesota is not one of the states that has prohibited local governments or businesses or schools from taking those actions.
Great, thank you.
Your next question is from Brittany Ehrman from KSTP. Your line is open.
Hi, thanks for taking my question. So we talked about this already. There are reports of people already getting a booster shot on their own. So what does the process look like to verify patients are in this group before getting the shot, or will this be based on the honor system?
Well, Chris can speak more in detail to what vaccine providers can do to verify someone's whether they've had their full series or not. But for a lot of certainly the walk-up kind of availability in pharmacies and others, I think it often is the honor system. So again, we just want to be as clear as we can with folks about what is recommended and what is not recommended at this point in time. Chris, what would you add about sort of the verification or the honor system?
Right. So, part of the reason that we talk about reaching out to your provider or hearing from your provider is if you are someone who falls into this very limited category of severe immunosuppression that, would be like someone who's had a solid organ transplant, that, your healthcare provider is going to be the one that will really have that information. And so they will be best able to make those determinations. I want to reiterate that in the absence of a recommendation, just seeking additional vaccine is not the right thing to do. And if we don't have a good understanding to make a recommendation, you may think that I'll get a booster now. That could undermine the impact of a booster when you really need it. For the individuals that we're talking about, we're not calling it a booster. We're calling it a third dose as part of their primary series because they did not mount or are unlikely, based on the data, to have mounted a sufficient immune response. So I think it's really important that we make that distinction for people. Yes, to some extent it will be on the honor system, but people need to keep in mind that their health, their best health, is not necessarily being kept in mind if they're just seeking additional vaccines before it is recommended.
Okay, thank you so much.
Your next question is from Mackenzie Davis from KAAL TV. Your line is open.
Hi, thank you. So now with these third doses for individuals who are immunocompromised, I know you said these doses are already kind of in place or administered across the state, but what does the timeline kind of look like? Will they go to higher transmission areas first, or is there a plan? I know you kind of touched on these doses are kind of already out there, but what happens if we would we run out or things like that? Is there a plan for that?
Yeah, this is Jan, and just something important to know is that the federal government some time ago changed the distribution system so that there's not a specific allotment anymore to states, but rather states can order what they need on a 24/7 basis. So we used to get an allotment once a week and order at that point, and that is no longer the case. This is now a much more rapid and flexible system. So we know where the doses, that the supply that's already sort of on hand and in reserve, so to speak. We know where those are. We've been helping facilitate moving doses around the state to use up some of that supply. We have to keep an eye on expiration dates and the like. So there's already a pretty good system for moving things around when that needs to be done. But the key is we've got plenty of vaccine right now and the ability to get more very, very shortly if we need it.
Awesome. Thank you.
Operator, we have time for one more question.
Thank you, sir. Your last question would be from Bill Werner from Minnesota News Network. Your line is open.
Thank you for entertaining a second one. Commissioner, I just want to follow up on the question from my colleague, I believe from Duluth, about possible additional restrictions on businesses. And I understand that there is not a peacetime emergency in place, but you folks would be in a position to recommend to the governor perhaps that he consider that if the situation were to become dire enough. Are we kind of getting to that point? Can you give us some sort of a feel for that?
Well, we're certainly going to be watching the data closely, as we always do, Bill. But we definitely don't like the trends. We were a lot happier when all the indicators were going in the right direction. But we are, as I think Chris has mentioned, we are not in the same position we were in earlier waves. We have more of the population vaccinated, and we have, I think, improved treatment, improved comfort level by providers in dealing with COVID. Our case rates, while they're going up, are nowhere near where they were at the peak, the big peak in the fall. So while we want to just make sure people understand this is a really important, pivotal time for us to just redouble our efforts in prevention so that we don't get into that situation, we are in a much more favorable position to be able to keep this thing at a manageable level right now if we take action.
What kinds of things, Commissioner, at what point would we have to be for you to maybe, be seriously considering recommending to the governor that he consider another peacetime emergency? I mean, is there a certain case positive rate we would have to be at, a certain number? I mean, I know there's a lot of factors, but what kind of things might play into that?
Well, I think we will just try to learn from our past experience with the prior waves, and it is, as you said, a combination of factors. It's where are those metrics? What do we see happening around us? in other states and other regions? What are we learning about the duration and the intensity of these peaks that are Delta driven? Do we think that we're continuing to accelerate or slowing down? So it will just be a constantly monitored situation. And again, I think we're very aware that this is a national phenomenon, and we'll be just looking closely at what we can learn from regions that are ahead of us, at least in time, and hoping that we, with our mitigation strategies that we can all practice, that we can keep this wave from going much farther. That's our hope.
Thanks, Commissioner. Appreciate you taking a second one from me.
And that is the wrap-up for today's press briefing. Minnesota Department of Health Commissioner Jan Malcolm there responding to some reporter questions, starting out the hour talking about how we are not done with this pandemic yet. The Delta variant now representing more than 95% of sequenced specimens, and the CDC's county metrics show nearly all of Minnesota counties in substantial or high transmission of the coronavirus. The good news, however, is because more people are vaccinated, people are not getting as sick, and they are again encouraging those who have not yet had their shots to do so in order to, well, things like the state fair go to safely. But in the meantime, reiterating the advice to mask up, stay home when sick, wash your hands. Delta is a whole different thing, and we all need to do our part, is a quote that came out of today's press conference. They also talked about this booster shot, which Chris Hairsman, infectious disease director, tried to clarify. It's not actually a booster shot. It's a third dose for those who didn't get a good immunization or in the first time around. So what they're saying is that they're waiting on the guidance from the CDC as to who will get those extra shots and when that will happen. And we should know more later in the day about that. We'll know more later in the day about all of the news as we follow it here on NPR News. You can read about it online, nprnews.org, and listen to our newscasts and All Things Considered, our daily wrap-up of the major stories of the day, including all the news on the coronavirus. In the meantime, 9 minutes now before 2 o'clock, let's rejoin our regularly scheduled program, Science Friday.
That they won't.